My name is Curtis Williams. I'm the Chief Resident of the Internal Medicine Program here at Lake Cumberland Regional Hospital.
I'm Nicholas Fugate. I'm a Chief Resident here at Lake Cumberland Regional Hospital. I'm in the Family Medicine Program, and this is my 3rd year.
Kind of my driving passion to become a physician kind of goes back into when I was in high school. I grew up in Pike County, really rural Eastern Kentucky. Poor health care, poor access to health care. People get sick, they need help, they need EMS. It takes 40 minutes to come to our house. When you live in the head of the holler, everything's a little more difficult. I had a very bad experience that eventually led to the passing of my grandpa, and then that was when I was a junior in high school. So from that point on, I said, I want to be a physician. I want to return to the 606, the area code, Eastern Kentucky, to kind of help people like me, like myself, like my family, so they don't have to go through problems like that. When I was in medical school, I heard all these great things about Lake Cumberland, the residency program here. Dr. Weigel, actually one of the first things that I heard was, how tight of a ship that he ran over here, that he was, very structured. He was a great teacher, and the program here was, very strong. I came here, auditioned as a student, and I was just amazed by the structure of the program, how intelligent everyone was, and what a fine old machine that this internal medicine program was. As soon as I left day one, I texted Dr. Blackburn. I said, I love it here, this is where I belong, and I don't even need to go see anywhere else.
I chose to come to Lake Cumberland. I initially auditioned as a medical student. I had a close friend or somebody that was close to me that was here, and he recommended this place. When I came as a medical student, I got more learning in that 1 month as an auditioning student than probably my core rotations in medical school. So I knew that I wanted to be here, and I'm glad I made that decision. I talked to some of my friends from medical schools that are in different residency programs, and some of them dread going into work every day, and I've never had that feeling. I enjoy going to work every day and getting to work with a close-knit group here at the Family Medicine Program. Here at Lake Cumberland, we expect residents to turn into competent and compassionate physicians. That's the ultimate goal here.
So the internal medicine and the family medicine program work hand in hand with each other. Coming in as an incoming family medicine intern, they're required to do 4 months of inpatient medicine. So we work them into our inpatient teams. Through 4 months, they become part of our unit as well. So the programs work close together to provide inpatient and outpatient care. And we also work closely together in the outpatient clinic. We meet every morning in the GME building together for morning report, and then we come together on Fridays for noon conference for case presentations. And every Friday those rotate between the inpatient internal medicine teams and the family medicine program. So the graduate medical education building to our program is home base. That's where the headquarters are. That's where Dr. Weigel, Miss Libby's office is. We have morning report in the conference rooms, and we have noon lectures. Occasionally we have guest speakers that come in, and that's where we all meet.
I think it's a great thing that we're so tight-knit with the internal medicine program. I know for me personally, when I was an intern, I grew really close bonds with a lot of the internal medicine interns as well. So you're spending 12 hours a day with some what turned out to be great friends. So it's just a great tight-knit group, I think, between both of us. And we both learn from each other, and I think that's a great thing. Once monthly, we have the Morbidity and Mortality Conference, and in that conference we'll have not only the family medicine program, but the internal medicine program. So I think it's great to have both insights into outpatient care and inpatient care, and how things may have gone differently for each patient, and what we can learn from that. So this is the emergency department. You'll have at least one rotation here during your residency, and then a lot of our family medicine residents do extra rotations here. You learn a lot in the emergency department. Our emergency department sees over 45,000 people come through its doors annually. It's a lot different than working in the outpatient clinic or even working on inpatient. So a lot of people enjoy the fast-paced style of the emergency department.
So the ER, as a resident, we're down here quite often. Every time we get admissions, you come downstairs, you see the patient, admit them directly from the ER. In the internal medicine program, we're required to do 1 month of emergency medicine, so we're down here for an entire month to do 14 shifts, working under one of the ER trained physicians here. Mainly what we use the ER for is a transition from people when they get admitted to bring them inpatient to the floor. One of the strongest points for the internal medicine program here at Lake Cumberland is that we have an open ICU. And what that means is that every day we come in, we get our list, and we have ICU patients that we see and take care of every day. We don't have a dedicated month blocked off for ICU care. That's something that we get every day. So over your 3-year career, seeing ICU level patients every day, you have much more exposure. You don't learn skills and then lose them due to lack of exposure. So that allows us to have bedside training, to do procedures, to do central lines and arterial lines and lumbar punctures, and all the advanced one-on-one skills that we're able to do here.
As family medicine residents, not only during your intern year when you're working with the internal medicine program, but during your second and third years when you're working with the family medicine team, you'll have access to open ICU, and you'll be taking care of patients both on telemetry, on the medical floor, and in our open ICU. This is labor and delivery. Each family medicine resident has 2 rotations here, one during your first year and one during your second year. You'll get hands-on training here, get your own deliveries, and be able to participate in C-sections as well. You'll be working hand in hand with the pediatric hospitalist. You'll be doing daily rounds here where you'll get a lot of teaching. You'll see a lot of respiratory illness and RSV. So you're working closely with the family as well and ensuring that their son or daughter is getting the best care possible here at Lake Cumberland.
So this is the neurosurgical unit where we take care of patients that come in with strokes, seizure disorders. We share a lot of the patients with the neurosurgery team, post-op from craniotomies and burr holes and procedures such as that. The resident rooms here on the 4th floor on 4R, this is the resident team's home base. We have 3 rooms based on the color of the team. We got green room, blue room, and red room, and that's where all the teams are stationed out of. That's where our day starts, and that's where our day ends. With the volume of patients that we have here at Lake Cumberland, we've expanded from 3 inpatient internal medicine teams to 4, and the upcoming 4th team will be the yellow team, and that will give a senior resident the opportunity to work one-on-one with an attending physician to learn things such as billing, case management, real-life issues that sometimes can get overlooked in residency to help us better prepare for the future moving forward.
LCMA is our home base as family medicine residents. You're able to walk from your inpatient rounds and working on the inpatient side of things, take 20 steps and you're in the LCMA building. And for most of your rotations, you'll be working both in the hospital and in the outpatient clinic, so it's very convenient. This is the family medicine workspace for our residents. There's plenty of computer space and room for not only the residents but the medical students as well. So as an intern here, there's a steep learning curve. You have to learn how to use the computer system. You have to learn how to put in the labs and imaging that you want for each patient, and then you have to sign out to the attending. Initially, the attendings will go in the room with you, agree with your assessment and plan, or disagree and kind of lead you on the right direction. On a typical day for an intern, you might see 1 to 4 patients. As you begin learning the system and learning the pathology, as a second and third year, you might see 16 patients in a day.
As a resident, we were directly involved in coming up with the treatment plan and the care of, these patients during the COVID-19 outbreak, from how, they were taken care of in triage in the ER, or whether they came in as a transfer, to when they hit our, COVID-19 intensive care unit, up until the time that they were discharged home.
At the walk-in clinic, you're expected to see a high volume of patients. Just like the emergency department, you don't know what's going to walk in, and you may not be familiar with these patients. You're expected to be able to treat the patients effectively. It's very challenging but rewarding in the same.
There's a lot of expectations placed on us as residents. As interns, we're involved, directly with the care, of the patients. We're the point person. They're going to see the intern more than they see the senior resident or the attending physician. The senior resident always sees the patients with the interns when they first come in, so you have that extra level of, protection. The intern sees the patient, the senior sees the patient, and so does the attending. So you have 3 sets of eyes to make sure that we're very thorough and don't miss things. And I think that in all aspects, the residents as a whole are a very integral part of the care team here at Lake Cumberland Regional Hospital. I think some of the benefits of being in a smaller hospital like Lake Cumberland, you don't have a lot of the other specialties, a lot of the other programs to compete with. We don't have anesthesia, residency programs, so we do our own intubations, we do our own central lines, paras, thoras, LPs. The procedure aspect is something that, no tertiary center could match at all.
Family medicine, and especially the family medicine residency program, it affords you so many opportunities. I know that some of the residents that have graduated here, they've gone on to do ER fellowships. There's one resident here that's working in our ER right now as an attending. And so our residency program prepares you to branch out and be able to accomplish what you want to do. And if you're interested in a certain field, certainly we have attendings that can lead you into that way and be able to teach you, one-on-one about whichever field you want to specialize in, or if you want to stay in family medicine in the outpatient clinic, certainly prepare you for that as well.
And I think that says something to how well-rounded, this program will make you as a physician. If you go out and practice in, a small community in a hospital, you're expected to be able to do everything. And if you can't do those procedures, then, you're not the best physician that, you could be, in our opinion. And I think this, being at this small setting, you get the procedures. The pathology here is, amazing, even in a small city like Somerset. The variety of diseases that we see here and the pathology that we see here is quite remarkable.
This community really kind of takes you in, and you feel like you're very welcomed. If you go anywhere and they ask you what you do, usually brings a smile to their face when you tell them that you're a resident working at the hospital, because they've had great experience with the resident teams here.
I've been very pleased with my experience here, both academically and procedurally. If I could go back and I had this whole process to do over, I would choose Lake Cumberland, in the blink of an eye.